You are tuning in to Access Live, a show about raising awareness, what's going on in the community, and to address the issues that impact youth and their families that have serious emotional and behavioral challenges. We are located at the Brookins Building at 1776 East Washington in Urbana, Illinois, and at the downtown location at 202 West Park Street.
Welcome to Access Live, a community education and engagement project of the Access Initiative. Today we are so pleased to have in the studio with us Mr. Francis Subai, who is the founder and executive director of Wells of Hope. And he lives and does this work in Kampala, Uganda, which is in East Africa. We also have our friend, our constant friend, Dr. Rebecca Ginsburg, who heads up the Education Justice Project. And what we're going to do today is talk about incarceration in Africa and incarceration in the United States, specifically as it relates to African Americans. So we're talking cousin to cousin here. And we're talking about the impact that incarceration has on families, certainly most especially on children. So we're excited about making that transatlantic connection today. So welcome, sir.
Thank you. I'm happy to be here.
Wonderful. And welcome, Madame.
Thank you, Imani. It's always great to be with you.
Always. So, Brother Francis,
Yes.
where did this come from? Where'd you get the big idea to come up with Wells of Hope? What was going on that triggered this?
Okay, there was 2002. Friends of mine maliced me, and they bribed the police with the $2, and I was put in prison. I was there for 68 days, sleeping on a thin blanket. I got inspired to begin Wells of Hope because I saw families suffer. Actually, my mother died after I'd been released. And I saw so many things families go through because of having a loved one in prison. Yeah, and over the years, because we began by doing taking food to the prison for prisoners who are living with HIV/AIDS.
Beautiful.
Then we did Christmas parties for children. From Christmas parties, we began a school. It's the only school that possibly is known of in Africa that is targeting or is made specifically to help children who have a parent in prison.
Yes. So then it's not just about their academic education, but it deals with their social emotional needs as well.
Because it takes this to help them cope with the parental imprisonment. And the most important thing that we do for these children, maybe I would say the wow thing, is to help them to have access. 3 times a year, we put them on a bus and they are able to go and have a direct contact with their parent in prison. Face to face, they are able to hug, they are able to laugh together, they're able
Daddy,
to eat like real. And do exactly that for about 1 hour with no restrictions.
Lovely.
But that is able to be done with Wells of Hope.
Yes.
Without
and
Wells
so
of
that's
Hope.
something you all negotiated with the prisons.
Yeah, that's what I want to see happening in the whole world, not just in Uganda, because issues that affect children of prisoners are transnational. They are a child in China who has a parent in prison, a child in USA, in Uganda, who has a parent in prison, will go through the same kind of feelings. And the risks are the same. It's only that in some parts, like in Uganda, they're extreme because of the poverty.
Yes. So interestingly, you may or may not know this, but the Black Panther Party that was founded in the mid and late 60s had amongst its many human services. People just think of them as carrying guns and being against the police, but they actually had a major human service portion of what they did, and one of those things was free buses to prison. And I myself rode those buses to go visit prisoners, because in the United States, most prisons are far away from urban areas. So most African Americans live in urban areas, but the prisons their relatives get sent to are far away.
So how often would that happen?
When it was well funded, weekly. Isn't that exciting?
It's exciting.
And so we need that.
Yeah,
we need that because we have children and other family members who are separated from their loved ones and they're traumatized. So the people in prison are traumatized by being kept from their community, but everyone they left behind is traumatized. So I do want to give dap to the Black Panther Party, which my brother was a part of in the city we lived in, and he made sure, and the others made sure, that people from the community could visit their relatives who were in faraway places. And so the other interesting thing that I'm wondering from you as well, we know, our audience knows about the mass incarceration of African Americans in this country. But what is curious is you end up having large prison populations of African Americans, but the people who actually work in the prisons are oftentimes white and rural because that's where the actual prisons are. So that sets up an interesting dynamic. Would you say something about that, Rebecca?
I'm happy to, but I really feel moved to say something about the trauma.
Please do.
That the children undergo. And I'm going to put my scholar hat on, you know. I'm a professor, and I want to recommend to people a recent book, 2014, that was written, published by Oxford University Press, written by a man named, I think it's Weidman, called Children of the Prison Boom. It's a powerful book, and the subtitle is How Mass Incarceration Impacts Families, or something of that sort. I want to recommend this book. I'm recommending it to everybody because it lays out in meticulous detail all of the research that's been done in the United States about the impacts of incarceration upon children. And this is his argument, and it's a really devastating argument. Given that mass incarceration primarily impacts children of color, and especially African American children, his thesis is that imprisonment is deepening the inequality in the United States between haves and have-nots. We know that it impacts individual children across a realm of dimensions: behavioral, emotional issues, academic, more likely to drop out, more likely to be incarcerated, more likely to experiment with drugs. We knew that on an individual level. What the book makes clear is that demographically, the impact of those responses among individuals means that as a whole, African American generations are being disadvantaged, and the inequality in the United States, particularly between poor blacks and poor browns and more well-to-do whites, is deepening as a result of incarceration. In two areas in particular that I found devastating when I read the book, it's very clear that incarceration is having a devastating impact. One of them is black children's homelessness. That incarceration has been proven now, and he's meticulous in his research, has been proven to increase black children's homelessness by a significant proportion. And I'd like to invite Frances at some point to talk about homelessness among children of incarcerated people in Uganda as well. And here's a figure I want to leave you with before I stop talking. The second is black children's mortality. 43% of black children's mortality can be attributed to the fact that they have a parent in prison. What's the mechanism? I'm not sure, but it seems to be related to poverty, the poverty that ensues when a parent, particularly a father, because we know that 95% of the people incarcerated are dads, are men. That particularly when a father is incarcerated and the family might be plunged into poverty, that contributes to lack of housing, insufficient housing, insufficient health care, insufficient food, and a variety of different factors that are contributing not just to homelessness, not just to poor educational attainment, but to the death of black children.
And that's devastating.
You know, and as Frances says, that's in the United States. I'm quite sure, hearing what Francis has had to say about the impacts of incarceration on children in Uganda, that although the research hasn't been done, and hopefully we can get that research done,
yes,
that parental incarceration is playing a role in the mortality of African children in Uganda as well.
Beautiful. And you've got a visual for us to talk about the impact that you're seeing in Uganda.
Yes.
So tell us about that.
Okay, if you can look at this chart, sorry. If you can look at this chart, it has a child here in the middle. This child is called Grace. She represents all the other children. The advantage right now is that all the good news that right now she's at Walls of Hope Academy. But before she came to Walls of Hope, I found her deep in the village. She had one dress. She didn't have shoes. She didn't have a knicker. She had never been to school. Now, she represents all the other children. What do these children go through? Children who have a parent in prison. There are so many things that they are risks that they are most likely to face. For example, child labor. Children start working when they're still young as 5 years. Because like in our country, when a man is put in prison, the wife will go and find another husband and leave the children with them by themselves or the grandmother. And there are cases where a father killed a mother or vice versa. So those children will stay by themselves. So that's why you have child-headed homes. Children go through nightmares. They are vulnerable to HIV/AIDS. They face anger. Like many of the children have come to Walls of Hope. They will tell you stories that they were having 1 meal a day before they came to Walls of Hope. They are most likely to get early pregnancies. They are likely to follow their parents in prison.
Yes.
And they have no self-esteem. They are vulnerable to child sacrifice. Like in our country, people sacrifice children. It's not allowed, but it happens under the carpet.
Old practices die hard.
Yeah, and children of prisoners are more likely to face this. And then they are stunted in their growth. You find a child of 10 years looking like 7 years because of malnutrition, and the other thing is lack of proper medical care. And they drop out of school. You see, all these problems, they are huge in a country like in Uganda. And a child of prisoner is most likely to face any one of these, but the common one is child labor and dropping out of school. Some of these problems are not only in Uganda. Even in a country like this one here, children could easily drop out of a school.
There could
because
be
they have
an
a
African-American child in the exactly.
Yes, they will get nightmares worrying about their parents in prison. They can, get pregnant early. They don't have direct contact. Like in this country, children who have a parent in prison don't have a direct contact with a parent in prison. And they are invisible and at a great risk. They don't have self-esteem. They are bullied at school, you see. So these are the problems. Maybe later I can talk about the intervention.
Yes.
Because as we talk about the problem, let's also look at the solution.
That's right. And so that's what we want people to remember, that the Access Initiative is about what you just talked about. Because what you're describing is this mass trauma, right? And so the Access Initiative is designed as a justice and trauma-informed intervention or effort. There's an effort to build what we call a system of care that connects the various institutions that are in young people's lives who are in trouble, and to design that in a way that it's informed by the understanding of trauma, and that it's informed by the understanding of what social justice should look like. So we are head to head there. So Rebecca, remind our audience about the Education Justice Project.
I'd love to talk about the Education Justice Project, and you'll have to stop me after a while. But I'm going to segue into how I met Francis.
Beautiful.
Education Justice Project is a unit of the College of Education at the University of Illinois at Urbana-Champaign. We offer 4 credit courses to men incarcerated at Danville Correctional Center, which is a men's medium high security state prison, about 35 miles from campus. We also offer a range of extracurricular activities, including writing workshops, a theater initiative, a productive landscapes initiative. We have guest lecture series. And we have a FACE program. FACE stands for Family and Community Engagement. And this is a unit of EJP by which we reach out to the families and loved ones of our incarcerated students. And we know most of them are to be found in Chicago. Most people who are incarcerated in the state of Illinois come from the Chicago area. When we founded EJP 8 years ago, we were moved to learn from incarcerated students in other prisons across the country how much their getting a college education had meant to their families. Yes. So we knew that we wanted to incorporate some sort of family engagement outreach with EJP. It's meant that we have had to educate ourselves about the impacts of incarceration on families and on communities, because with EJP at a research-run university, everything we do is informed by research. Yes. Everything we do is informed by best practices. So it was in that spirit that I attended a conference last year in Dallas, Texas, called the Prisoners Family Conference, to learn more about the impacts of incarceration, which we know are profound.
Yes.
Upon those who are associated with people, moms and dads, family members in prison. And I heard Francis Suby speak. Francis Suby was speaking about his work at Wells of Hope, talking about this extraordinary model that he's going to share with us later, the intervention model by which he and his staff and volunteers and supporters from across the world, including you have many supporters, I think, here in the United States.
Yeah, most of them are from here.
Sponsoring children and supporting your work. And I said, I need to learn more about that. So I went to Uganda in September and spent a week at the study week in Wells of Hope, learning more about the program and being continuously impressed by the spirit and the head that motivates this program. So we invited him to come back to campus and to spend a week with us here in Illinois, both in Chicago and in Urbana, Champaign, talking to our family members, talking to our incarcerated students at Danville, talking to people across campus from social work to education to African studies and other departments as well about the work, how we can get involved, and how his work can inform what we are doing in Central Illinois to reduce the harmful impacts of incarceration upon family members. It's one thing we can do while we have the system that we currently have, while we are hoping to institute better, more humane ways of responding to crime and violence in our society, like alternative to incarceration remedies that many of us are hoping will be part of the future in
And the thing that I love about what you're saying is oftentimes people in the United States specifically, but in the Western world more generally, think that what we do here is what we want to export to the rest of the world. We've got it figured out. We'll teach you how to do it. I have found in my experience, and clearly in yours, that we are best to listen deeply to what's happening in some of the most troubled, impoverished areas. Because when you have nothing, you must be creative. You must come up with something that works when you have so little resources. So communities like African American communities need to make these transatlantic connections. We can learn so much from you because we have few resources, you have few resources. I think it cuts down on a lot of arrogance to think the United States is always about the export when we need to be importing good ideas. At this point, we're going to take a short break for some announcements, and we'll be right back.
Access Live can be heard every Wednesday afternoon from 2 to 3 p.m. on WBCP 1580 AM in Champaign, Urbana. You can learn more about the Access Initiative by visiting their website at www.access-initiative2.org.
And we're back. I am Imani Bazzell, your host for Access Live, a community education and engagement arm of the Access Initiative. The Access Initiative exists to develop a system of care in Champaign County that is trauma and justice informed. And so that's why we're so excited today to have Brother Francis here from Uganda and Sister Rebecca here, who works right at the university, who have found one another and found this thing in common, this problem of mass incarceration. So how does incarceration affect families, not just the people who are traumatized by being in prison, but what are the ripple effects that it has on their families and their community. And so, Rebecca, you talked about coming up with the FACE program, which was a way to make sure you all were addressing the question of impact on families. And you, kind sir, have developed a lovely model, we want to call it a model for other people to replicate, called Wells of Hope, to help make those connections. Now, I have to say, I'm curious, how do you keep the doors open? How do you make this happen? Who's paying for this?
Oh, thank you very much. I have friends who are sympathetic of the work that we do, but mostly here in America, individual donors. Then I have people who sponsor the children. Actually, some of the things I do when I come here is to ask people to sponsor children. Some people sponsor individual projects. And then, like, my coming here has been funded by the AJP.
Yes.
Yeah. So that's how I'm able to move. But it's not easy. Sometimes it's too difficult for us to do.
So is there a profile of who in America would support Wells of Hope? Are you getting a large response, for instance, from the church community, social justice community? Who are the people who would tend to sponsor a child who live in the United States?
They are mostly individuals.
Okay.
They are friends like you. Today you can decide.
Because you know you got me. It's all over for me.
Yeah, so today you can decide to support
Yes.
me. So frankly, they are mostly individuals. They are no
Yes.
groups really. Like.
Okay. Okay.
Yeah.
So there's no sort of the church of so-and-so
No.
has adopted.
No.
Would that be a strategy you might want to look into? Is that another way of thinking about
Yeah,
fundraising?
we want to explore other ways.
Yes.
We are calling upon different people to come and support our work. Corporations, non-profits, churches. And churches should play a leading role.
Yes.
Yeah.
Yes. And I know here in our community, the United Way, the United Way houses Big Brothers, Big Sisters. And they got some dollars, a grant, to specifically target the children of the incarcerated.
Yeah.
So this is like a mentor Big Brother, Big Sister program.
Yeah, exactly.
So they're specifically looking to find mentors or big brothers and big sisters for children whose parents are incarcerated.
Yes.
So that's a lovely thing. Have you all had any connection with Big Brothers, Big Sisters?
We've looked at that program.
Yes. So yeah, we want to make connections wherever they can be made because we want to make sure they're coming from the right point of view, right?
Yeah.
And we'll leave that at that.
And one thing I want to say is that when you support Wells of Hope, it's not just the children of prisoners in Uganda, Africa, but our impact is going across globally.
Wonderful.
Because I've talked in UK, I've been here in the US, I've been to Switzerland, and everywhere I've been talking, people are loving our model. They're saying, let's do something about the children who have a parent in prison. So it is touching all the children. Even as I speak, I'm not just talking about the children in Uganda.
Yes.
So whoever supports us has to know that they're supporting all the children world over.
So I want to ask what you're seeing at home and when you travel. Does there appear to be an increase in incarceration in Uganda and other places, or a decrease? Because we know that's a big issue here in our country that's being addressed right now. But what are you seeing? More prisoners, less prisoners?
Yeah, I think there are more people going into prison
Yes.
today. Let me give an example of Uganda. At the beginning of last year, we had 34,000 people in the prisons. As I speak right now, there are 39,000 people. In a period of just 1 year, about 5,000 people have gone in the prison.
Yeah.
And I think in the US, it's the same thing. Many
Yes.
people have gone in a prison. So we need to adopt strategies, interventions that lessen
Yes.
the numbers of people in prison. Because if we do that, it will lessen on the money that governments spend.
It costs money to
Yeah.
imprison people,
Yeah.
doesn't it? Yeah.
Yeah, a lot of money is spent in keeping someone in
If
prison.
we would spend the money we spend on keeping people in prison,
Yeah.
if we would spend that on their education,
Exactly.
we'd get so much more out of it. So
Yeah.
I know that's a big way that you all talk about the question of incarceration, because some people, they respond to money.
Yeah.
You know, they may not care about the people who are in prison, but if you tell them, oh, you could make government smaller, you know, you could spend less public dollars, then actually their ears perk up.
And one of the interventions which we need to adopt is family visitations.
Yes.
I wish the governments knew. I wish they knew how powerful visitations are. You know, this is just pivotal. It is at the middle, but it creates big ripple effects. The prisons benefit. The prisoners benefit, and the families benefit. If you allowed quality visits, and we're not just talking about a mere visit, let the visit be a quality visit. Can the children visit, have longer time?
Can they touch them?
Can they touch? Can they hug? Can they kiss? You know, let them do homework together.
Yes.
Let the children go away from the prison when they are happy, looking forward to the next visit.
And you know what? That's just normal.
Yes.
That's common sense.
Yes.
But here we find ourselves having to argue for basic humanity.
Yeah. And by the way, it's not supposed to be even a privilege. It's supposed to
it
be
should
a
be a
right.
right. There you go.
Because when you read in the United Nations Convention on Rights of a Child, I know United States just signed that convention but didn't ratify it. But if you speak like in other places like Uganda where we've been ratified, you know, Article 9 closed, Article 9 clause 3, it says that as much as it is in the best interest of the child, a child who has a parent in prison should be allowed to have direct access. So it's a right.
It's a right. It's an international right.
Yeah, it's international. It's not supposed to be a privilege.
Yes.
And sincerely, if we love our children, if we love our tomorrow, because the children are the future,
yes, they are,
then let us be very careful how we handle them.
Let's not keep traumatizing
Yeah,
them,
because
right?
let me tell you this. If we don't do that, then the children are most likely to follow their parents in prison.
That's right. We're going to pay for it.
It has been proven that about, like in the UK, about 6 children out of 10 children who have a parent in prison are more likely to follow their parents in prison. And then the other thing is, if a parent or a family is visiting a relative or a loved one in prison, there are chances that this man or woman, once is released, he will not commit crime and go back.
Right, so we call that reintegration.
Yes.
How do we make it easier for people who are released to reintegrate into the community?
And so the family visitation, quality, and I talk about quality family visitations, can enable the prisoner to get reintegrated. It can also help the child to think good about the parent in prison, not to worry, not to get traumatized, and to solve a lot of all these other issues. And I don't know whether you could allow me to share this model.
Would you please?
Yeah, because it is in this model that we have, that we developed, the Worlds of Hope model. It has the parent in prison, we have the family in the community, and we have the child at the school. In this case, the residential school, which is Worlds of Hope. But this could still apply here if you don't make residential, but a school.
Yes.
Yeah. So how does this happen so quickly? We work with a parent in prison who gives us directions to where the child is. And the child is in the community. So we go, I track the children, I go in the communities, and I look for them. Sometimes you may not get them in the first home because the family has disintegrated.
Yes.
You see? But if we did this very early, then the disintegration will not happen. But most times we go when some time has passed, you see, and that's where we need support. So anyway, if we are able to find some of these children, you encourage the guardians who are able to bring the child at the school. Yes. And at the school, the children get food, medicine, clothes, and they are able to get free education. Then most importantly, what we've been talking about, you remember? The visitation.
Yes, quality.
Quality visitation. These children will have taken like 10 years, most of them, without seeing a parent in prison. Some of them have been deceived that the parent died. Oh. You see? So, anyway, 3 times a year, we put them on a bus, and that is by Worlds of Hope. We put them on a bus, we take them to see their parent in prison. And when they meet there, they're able to have quality time. And you know, it began with a parent in prison. We got the family in the community, we go to the school, from the school we go to the prison.
Beautiful.
You know, and then the children, when they are able to go back for a holiday before they come back to the school, they take the good news to the community.
Yes.
They say, we saw him, he's happy, he's okay, he sent you greetings. Actually, he wrote a letter. And then this family becomes encouraged also to start visiting.
Yes.
So the child becomes a connecting factor, is at the center of bringing about a big change. You remember seeing the other child in the other diagram,
Yes.
this very dirty, very sad, but now here the children are what? Are happy.
Clean, happy,
If there's anything
nourished.
I could emphasize about all this, it's the visitation.
Beautiful.
And I wish I could spend the rest of my life just talking about visitation.
Well, we're going to try to do whatever we
yeah,
can to
because
help
if we
make
did
that
that,
real.
if we did that,
Yes.
we would stop families from suffering. You know, we are punishing the family.
We are punishing them.
Yet they didn't commit the crime.
That's right.
Let's allow them to visit.
So this whole question then about a right versus a privilege, sometimes I'm an insomniac, I own it, hate it, but it's me. That means I can't sleep at night.
Yeah.
So sometimes I'll then flip the television on, and there are often, because I watch a particular news channel, that late in the evening, early hours of the morning, they have documentaries and shows set in prisons. So we can see prison life in different facilities. And oftentimes we can see how they use visitation as a privilege instead of a right. So if the prisoner doesn't behave the way they want them to behave, then they won't allow them to have visits from their loved ones. And so they use it. We have this phrase in the United States that we say, the carrot and the stick. So the carrot is, if you act right, we'll let you see your family. The stick is, if you don't act right, we're going to keep you, we're going to hit you with that. We're going to punish you for that. But we know, I think research tells us, the closer families can be to the incarcerated, the more the incarcerated can begin to think about, how can life be for me when I get out of here? How can I behave in a way in here that I can take advantage of education opportunities, maybe spiritual growth opportunities? So we have better reintegration, and we're not traumatizing families, and we're finding a way to stop the cycle. So it's this cycle of incarceration.
Yes.
So Rebecca, on this question of visitation, what can you share with us right here in Champaign County?
I can share some concern right here in Champaign County. The Champaign County Jail appears to be, and I don't have this verified because we're having trouble getting information, but appears to be in the process of considering eliminating all person-to-person visits at the county jail in favor of video visits. Now, you probably have heard in the press about this new technology that enables people in far-flung regions of the state to visit with an incarcerated loved one via video conferencing. And it seems it has its place.
It does have its place.
It has its place. But in a county jail where you might live a mile from the county jail and your incarcerated loved one is being housed in the county jail, there's no good reason to disallow family members and loved ones from having face-to-face visits.
Well, but we know the reason. We just disagree.
There's no
good reason, exactly. The reason
good
is
reason.
about efficiency, right? Right? How do we make it easy for the jailers?
I think it's about efficiency, and I worry, Imani, I worry that it's also about profit.
Yeah.
Because the company that is providing the video conferencing stands to earn some dollars by providing the service. I don't know that, but
it's something we need to look into.
And, you know, given the history with phone contracts,
that's what I was going to say.
My suspicion is aroused, my curiosity is aroused about the different forces that are contributing to this potential proposal
So
being put on the
essentially,
table.
when people who have been incarcerated here locally, you have to collect calls if you want to be able to talk to your loved ones. And then there's this private company who's making huge amounts of
way
profits,
more than market
charging way more to prisoners and families who have the least resources, charging them these exorbitant fees to connect with one another.
The good news is that there's a small campaign, and I won't say small, there's a campaign starting in Champaign County to explore what is happening with the county jail and to express to the officials there their sincere concern that if we look at all of the data, it's very clear that visits between family members and incarcerated people contribute to safer conditions in the facility, better reentry outcomes, and stronger relationships, stronger health outcomes and mental health outcomes for the family members that are on the outside. So we're going to be urging them, and the CUPCJ, let me think about what that stands for. Champaign, Urbana, Citizens for Peace and Justice. The initials come out of my mouth without my knowing all the words. Citizens for Peace and Justice, who are spearheading the investigation and the campaign to consider visitation on a more humane basis and a less efficiency-driven basis, but also on a practical basis. We know the good that comes from having face-to-face family visits.
Invest in what works.
Invest in what works. Invest in what's proven.
Can I say something?
Yes. You clean this part up, right? Okay. We have 2 minutes. Okay. Should we take the break now? Or okay.
Since we're already talking.
Yes. We are going to take a brief break, and we'll be right back.
The Access Initiative mission is to build a trauma and justice-informed system of care designed to create a healed community that works to ensure that youth and their families are resilient, resourceful, responsible, and restored.
And we're back. I'm Imani Bazzell, your host for Access Live, a community education and engagement initiative of the Access Initiative. We are so pleased to have in the studio with us our good friend, Dr. Rebecca Ginsburg of the Education Justice Project, and also Mr. Francis Subai, who is the founder and executive director of Wells of Hope, which operates out of Kampala, Uganda, but you've also shared with us that it's gone global. What do they say? It's gone viral. Everybody's in on it now. Now, we do know that we can have sticky political situations, so we're going to try to steer clear of those in Uganda. But we're going to talk about them in the United States for a moment, because one of the things we've addressed on this show multiple times is the question of mass incarceration, the question of racial disproportionality and disparity when it comes to incarceration.
I have good news.
Yes.
I want to talk about Eric Holder, the U.S. Attorney General, and his advocacy of a proposal by the U.S. Sentencing Commission to look into this.
Yes.
So we know that incarceration in the United States has risen substantially since the 1970s, that we are incarcerating more people than any other country in the world, and we are incarcerating more people per capita than any other country in the world.
And the impetus of this increase in incarceration was connected to the drug trade.
You know, it's complicated.
Talk about that.
So we know it. We think it has something. We know it has something to do with the war on drugs. There are many other factors as well, and I'm hesitating because I was just talking about this in class, and I'm trying to not sound like a lecturer.
Listen, you have permission to sound like a lecturer for the next 2 minutes.
There are all sorts of forces that contribute to increase incarceration in the United States, and its racialized nature, so that people of darker skin, African Americans and Latinos, and Native Americans, indigenous peoples, are more likely to be incarcerated in this country than are white people for the same offenses. And it's very important to qualify that. And Eric Holder is, I'm so gratified, stepping up to ask that we examine this. There are a lot of people who are in prison for non-violent drug offenses that, were they committed in any other country, they would not be incarcerated for. So possession of small amounts of drugs, for example. In the United States, you could get sentenced for years for those sorts of offenses. And
because of these mandatory minimums.
Because of mandatory minimums, because of lack of judge discretion, because of the war on crime, which is another story. But if I know you've talked before about The House I Live In,
yes.
which is a wonderful movie that I want to recommend to
yes.
viewers.
Tell people about that quickly.
Watch The House I Live In, because it helps to understand the political forces and historical forces behind the war on drugs and the fact that it hasn't worked. And that other countries, again, we're speaking about, are learning
what
from
we
other
can learn
models,
from others, yes.
That there are other ways to more effectively address any harms that do arise from drug use.
So folks can look up
Treating
The House I Live In on the internet to find out what you're talking about.
To find out why we should be treating it as a public health issue and not as a criminal justice
And
issue.
recently, we had the director of the Illinois Department of Public Health on the show.
Okay.
And the thing that was exciting about having him, one, he's a brother. So like Eric Holder is like the chief lawyer for the country.
Okay.
He's like the chief doctor for the state, if you want to sort of come with some analogy. And he is of the school of thought that violence is a public health issue, actually not a criminal justice issue.
I so appreciate that line of research to help us understand the emotional and health factors that go into acts of violence, that go into sort of the violence generally, to treating it as a public health and as a social
issue. It's
a
social
rather
issue.
than an individual weakness or an individual failing. Back to Eric Holder.
Yes.
So the U.S. Sentencing Commission is exploring the possibility of revising federal sentencing guidelines when it comes to charges, nonviolent drug offenses. And many of us hope two things. First, that it will reduce the number of people who are incarcerated because of the impact of incarceration on those in prison and the families and the communities to which they belong. Second, that it won't end there. That we not feel satisfied and complacent about reducing the nonviolent offenders at the risk of not asking ourselves what we can do to better treat and address violence in our society.
That's because if violence is a public health issue, that gives us a whole other lens to think about how we do crime and punishment.
Absolutely.
We want to take a look at the whole thing. Yeah. But right now, the Attorney General, the lead attorney for the nation, is taking these first baby steps.
Absolutely.
And we're thankful for that. We just want to say, let's not stop there. And we're so happy that we have a local community-based organization that watchdogs that kind of thing, right? The Champaign-Urbana, CUCPJ again. Citizens for Peace and Justice, right? So they're like our watchdogs and our activists on the questions of peace and justice, and incarceration is a big part of that.
Yeah, I think people like Aaron Ammons and James Kilgore have been such wonderful citizens to our community in helping us bring in a more just, safe, peaceful Urbana-Champaign.
They have. And without being partisan, I think it's interesting. One of the ways, because this show is about community engagement, what happens when community activists say, we've got to get involved in electoral politics? Because until people like us are actually in the seats of decision making, maybe things won't change the way we need them to. So a very active member of Citizens for Peace and Justice is running for state representative in the 103rd District, which we're sitting in right now. So that's interesting. And let me ask you, Brother Francis, has there been any talk of that in Uganda or in other places when we think about people who have become active with Wells of Hope, or just active around the question of incarceration, thinking about running for offices or anything like that?
I'm not so knowledgeable about that.
Okay, that's all right.
Yeah.
So, tell us about, give us a story or two about opening this school and the impact the school is able to have, and introduce us to a couple of the kids and how it's changed their lives.
Okay, thank you very much. I'll talk like about two children. We had this boy, it's called Brian. You see, as I told you, when the parent in prison gives me the directions or contacts of his family, and you know, some of these is after some time, because there are so many of them, so we can't go to all of them so quickly. But there's this family, it's like 8 hours away from Kampala. So I get onto a bus, I go there, and I was just tracing, finding out how many children does he have? Are they at school? And you know, like back in our country, men produce a lot of children,
Yes.
and they have different wives. So there was this young boy I found, he's called Brian. He was seated, and he had been knocked by a motorcycle, and his leg had broken, and it was rotting. He had this stick which he was using for chasing away the flies. And his friends were playing, and for him was alone. His mother had gone to the gardens and was alone. So I get there, and I was beaten. I was disturbed. I said, now what do I do about this? So I come back to Kampala, and I put up this story on Facebook. I did that like about 3 times. You know, sometimes you put up these stories and people think you are up to just getting money. Anyway, long story short, I was able to get this boy to Kampala and take him to a good hospital. And I got friends from the United States who sent me money. And I also got a hospital there that subsidized on the money. And now this boy is okay. He's walking, he's running. They had said that his leg had rotten a little bit, and they had cut off 1 centimeter, and he needed a shoot to make the leg longer. But miraculously, that
But he didn't lose the leg.
Yeah, he did, and he's fine. He's walking, and he's growing. Oh, well. Then there was this other girl. She's called Mary. Mary had been sold by the mother to work as a housemaid somewhere in town. They stay in a village, but is trafficked to the town to work as a housemaid. So I had to intervene and told them that we have room for this girl to come and study.
Because you told us earlier about children being exploited, their labor being exploited.
Exactly.
And this was an example.
This is an example. So we get Mary to Walls of Hope. And it was not easy. And you see, most of the girls in Uganda are very vulnerable to defilement. People can have sexual intercourse with the children even as young as 3 years.
We want to make sure people understood what you said. You used the term defilement.
Defilement.
And what we would call child rape. That's what you mean.
Yes, exactly.
Yes.
So they do that, and with a child who has a parent in prison, the chances are high that
they're
they'll
more
be defiled.
vulnerable.
Yes. And also they give them out to in early marriages and get bride price. What would you call that? Like dowry? Dowry. Yeah. So they do that. And for a child who has a parent in prison, the chances are high that they will be given in to get dowry by the guardians. So we have children who have been saved, who I found, like there's a girl called Gloria, you know, she was just in the process, you know, yet even at that time she was looking after her sibling who was like about four years, and you know, she was not 4 years, a little young, like 2 years, and she was taking care of this baby, and they were just planning to even take her into marriage.
And you got her in time.
Yeah, I intervened just in time. They tried to deceive me, tell me all the stories, say, you see, the girl does not want to go to school, she's not interested. When I went in too deep and involved the local authorities, they said no, they have another plan for her. So we negotiated, we got the baby she was looking after, we gave her to the grandmother who was also sick, and then we said let her come to Words of Hope to have study, and she's there. And
you've changed her life.
Yeah, lives are being changed, and let me tell you, every day lives are being changed, and so many lives are going to be changed even years to come. We have set up a social policy, something that others will take on for years to come, and others can emulate.
Yes.
That's why every year we have the International Study Trip, Study Week, which she came and attended, and people are able to come and learn what we are doing. We get people from the UK, people from the US, people from different places. They come together for 1 week. Like this year, it's in June 23rd,
yes,
28th. Yeah.
So I think people are very interested in what you're saying and how we can replicate that here, which is why you brought him, right,
exactly.
Rebecca? And back to this funding thing, because, you know, in the Black community, it's like we never have enough, and we're always trying to figure out how can we pay for this, how can we make it happen? Do you get support from, so you're considered an NGO?
Yes, we're a non-profit
a non-government.
in Uganda.
So an NGO is what they call them everywhere else. In this country, we call them not-for-profit.
Yes, yeah.
So we want to understand that essentially you founded what we call a not-for-profit.
Exactly.
Now, do you get any funding, say, from the United Nations or maybe different countries?
Okay, thank you. As I said earlier, we are depending on individual donors. And this is how it works. You go to our website, wellsofhope.org.
Wellsofhope.org.
Yeah,
Yes.
.org, yeah. And you go there is get involved, you can donate, or you can go and look at the needs list, or also you can look at child sponsorship. We have a link for child sponsorship. You select a child and you're able to go to PayPal, and the money goes through a non-profit that is in Amarillo, and it's in the United States.
So they're what we would call your fiscal agent.
Yeah, we have an agent.
I got you.
So when someone does the donation, they get a tax receipt.
Right.
I want
And
to say
tax
something.
deductible.
Yes.
About how impressed I was with Wells of Hope when I was there, and how impressed I was with the strength of the U.S. dollar against the Ugandan shilling while I was there. Many times people think, I can't afford a $1,000 donation or a $100 donation. But you know what? $5 US
Goes a long way.
will make a difference in a child's life in Uganda. $10 US will make a difference in a child's life in Uganda. So I want to encourage people to consider sponsoring, to consider the $1,000 donations, but to also be aware that any gift of any size will make a difference in a child's life.
Yeah.
And we have a saying here, very simple. If you can, you should.
Yeah, the child sponsorship is $35 per month.
Yes.
Yeah.
But again,
But any donation.
But
that
any
you-
any
donation-
donations, you're not turning money away.
Yeah.
Let's be
the
clear.
But also we want people to come and visit. It's not just about money.
Yes.
Come and visit us. Come and work with us. Come and volunteer.
I understand that some people donate and then they engage in correspondence with the children.
Yeah, they write to the
You can
children.
actually form relationships
Yes.
here.
Yep.
I'm sorry to keep harping on this funding thing, but I'm still not understanding why you all would not qualify, or people have not helped you yet with getting. There's all this international money out there that I understand is for exactly the kinds of things you're doing. So, you know, maybe when the show is over, we'll talk about that a little more. But I'm still confused why you all are not accessing some international dollars that you keep having to rely on.
I want to tell you one
individuals.
thing. Children of
Okay.
prisoners is one area that people have ignored.
Yes.
They look at them as though they are part of the other punishment.
Got you.
Yeah, so everybody doesn't want to get involved.
We've
with
got
it.
to find another way to tell the story to increase the funding, because I
Yes.
think that there's funding that should be directed towards you that you're not getting, that
True.
I think you qualify for. Wouldn't you think, Rebecca?
I've spoken to him. I think he's going under every rock. I think Francis is energetic, and he's speaking to
can see.
people and at the United Nations. He speaks to a lot of churches
Yes.
across the
Yes,
across
yes.
the world, frankly.
Yes. I
But you
think
know
it's
what?
gonna
If you-
pay
If
off.
you have any hints, I know he'd want to hear them.
Yeah, I think
Yeah, in
it's
case
gonna
you know
pay
someone
off.
who has $100,000 US, tell him and
Call Francis.
Yeah.
I can't say enough about the quality of the work that you're doing in Uganda
Yeah.
and its replicability. So the other thing I'd like to get out to people is that if they are moved to try to replicate any aspect of what you're doing, that they could
Yeah.
also reach out to you
Yeah.
to find out more about how they can make this model work in their
Yeah.
community,
Yeah.
whether they're in the United States or whether they're from another part of the
Because
world.
it's very simple again. The parent in prison, the family in the community, and the school. All of them are important in
Yes.
transforming the child and transforming the community around us.
And we got a lot to learn from our cousins across the Atlantic.
Yes.
And that's
Doing
why I
wonderful things.
love this show and this conversation so much.
Thank you for the opportunity.
Oh, anytime we can. That's what Access Live is about, right? It's about educating the community, about engaging the community in what matters most to the people of the community. And certainly what matters most are the children and the impact that negative decision-making by adults have on the life of children. That's what we want to interrupt.
But we should not make the children to suffer
They
instead.
should not be punished because adults are making bad choices on the personal level or the structural level, correct?
Absolutely.
So we have been just delighted to have Mr. Francis Subai, who is the founder and executive director of Wells of Hope in Uganda, and to have Dr. Rebecca Ginsburg from the Education Justice Project, which is an initiative in the College of Education at the University of Illinois. A fabulous program, certainly on Access Live. You will continue to hear about it. Thank you to our watching and listening audience, and we will talk with you again next week.
Thank you for listening to Access Live. Access Initiative is a trauma and justice-informed system of care. We're glad that you joined us today. Please join us every Wednesday at 2:00 p.m. for Access Live. Thank you and be well.